Okay, so today's article review is actually a presentation from the SAGES meeting about robotic inguinal hernia repair, one of my favorite topics to talk about. Um, so here we have uh, physicians from the UPMC in Pennsylvania talk about are we creating a hernia to fix robotic hernias for a little bit of background. They talked that it's about the fastest growing procedure in general surgery, robotic hernia repair and inguinal hernia repair. Um, Numerous studies compared and showed minimal differences in outcomes, as multiple of our studies have demonstrated. Even when comparing to traditional old-fashioned open hernia repair, not comparing to a better preperitoneal repair. Um, However, as compared to open hernia surgery, robotic transabdominal preperitoneal inguinal hernia repair presents hernia recurrence because holes are made in the abdominal wall that are not closed for the camera and for the instruments. That was my experience when I trained on robotics. One of four patients had a hernia about a year after from his camera. So they looked at 560 patients and they did an assessment of 5 years or more to see if there's a hernia recurrence. Now, that's a pretty good amount of time for hernia research. So that's actually pretty impressive. Now, of the 533, 127 experienced some sort of recurrence. So that's one in four. So roughly 25% of patients had a hernia. The majority had trocar site hernias, but 10% had recurrent hernias. So 10% recurrence of hernia or 9% at 7 years. That's completely unacceptable. That is much higher than published rates for almost any open inguinal hernia repair. And so we are talking about a procedure that has not helped patients in the short term and has made it worse for them in the long term and costs twice as much. You tell me if that's progress.